So, guys, we got somebody you might know here. Not this guy. You know him. You guys definitely know him. But the hardcore ones would know this person. If you know this person, you're real. Okay? Because
real fan,
there's only been a few videos, not too many. You're in a lot. Cases in, like, you can count on one hand, maybe.
Yeah.
Yeah?
Like, maybe.
Like two?
So, this is the office, and we're in a period of transition with the site. And you are as well.
Yes.
Within research, greener pastures coming up. We got lots on the horizon.
Yes.
But we're just going to... Casey's been a coordinator almost exactly 10 years.
Yep.
Do you remember the exact date?
Yes.
When?
May 31st, 2012. Walked in here for the first time. SIV.
Okay, so 9 years. Soon to be 10.
Mm-hmm.
In like 4 months, 5 months, 10, it'll be 10 years.
Yeah.
Wow.
Yes.
We're going to have to do an interview in May. When did you say?
May 31st.
We'll have to do an interview that day.
10-year
anniversary.
There you go.
Remind me.
Okay.
Okay, so the good, the bad, the ugly within those 10 years. You've been just coordinating, site directing, a very small site that entire time.
Yes. Yes, I have.
So let's go with the good. And by the way, let's go look at some of these. Let's do it here because the background is like really nice here. So that stuff's going bye-bye. But look at this, guys. This is a decades of data. And this.
Yes.
Where is it? Chris is blocking it, but right there. Look. Decade of data. It's about 4 feet tall. And about
You got
5 feet
4
wide.
feet tall over here.
Don't forget my back row.
So if there's ever been an argument for eSource, this is it. Right, guys? And
Full of dead
E-Reg.
trees.
A lot of dead trees.
So
But in research, if it's not written down, it didn't happen.
that's real. It's definitely happened. A lot.
A
happened
lot
here.
happened.
All right, so let's go with like we don't want to make this too long, but the good, the bad, the ugly about being a coordinator for that long.
The good.
The good.
You get to help people. That's my biggest thing. I take a lot of pride in my work. My work is a reflection of myself, and basically to see people bettering their lives
And you've
with
seen
something that I've done. Oh, most definitely,
like how
firsthand.
many do you think like that you're thinking? You know, just come to mind like. Hey, I really helped this person now. There's like a couple dozen, or how many?
I would say definitely a couple dozen. Yeah.
That's impactful.
Yeah.
That's a real meaningful change.
It's definitely meaningful. It just gives, paychecks are good, but when you get that, when you see helping a patient, that's almost as good as getting paid.
And I already know what you're going to say about the bad. But we can call it out. I don't think it's me, but we'll see. We'll find out. But the patients, and I think one of the other things I want to add is one of the benefits of being at a very small site is you're not very hands-on. You are completely hands-on with everything.
Hands-on. Yes.
So the patients, they see you every visit.
Every visit.
It's not like some visits they see another coordinator. No. So you really get to know them.
Very much so. And that is a double-edged sword there.
Do you think you could ever work like at a USC or UCI and like be happy? Just as happy as you were doing this?
Yeah.
Yeah?
I think so.
Because they're streamlined, like you may not even see the patients all the time.
Well, see, now that, on the other hand, I love dealing with the patients. I love being the one that the patients come to all the time. So, on that note, then I probably wouldn't care for that too much. Because I do like to be on the hands-on and,
look at this. That's where I'm getting to. All right, let's go. Let's go the ugly. Bring it on.
The ugly. Honestly, I really can't say too much about it being ugly.
There's been a few people.
Well, you didn't say people.
Management. It could be anything. Some of the management, I've been with you through all that time.
Yes.
Well, most of it. At the end, no.
It makes your job really hard when you are battling
Difficult employers.
a very difficult employer.
And it was not this guy.
It was not either one of these guys. That is why they're now my employers again, because I love them both.
But we know, the real ones know who you're talking about.
Oh yeah, y'all are out there. You know who I'm talking to.
What else was bad besides the, what about monitors?
I've never had a problem with a monitor. monitors are on the
Never?
same
Not
team.
a one?
Not a one.
They love you.
Not a one. Because we are all on the same team. We have the same purpose at heart. I feel like the people that have problems with monitors are the ones that aren't doing exactly what they're supposed to do. Because if you have no problems in your books, then you have no problems somebody coming and looking through your books.
So,
Chris is getting intrigued.
so
now.
I would disagree with that at 100%, right? So I'd agree with that 99% of the time. But there are monitors that are extremely difficult to work with.
Yes.
And Dan knows one of them that I'm referring to.
I know.
Well,
one
I
of them.
think I know the one that you might be referring to as
Yeah.
well. And yes, he would have been a task
It's
for
not-
me to
she's
deal.
female.
Well, okay,
Female.
She, her.
she, her.
Yeah.
Well-
and it's not a matter of the site, anything on the site side.
Yeah.
Like this person, literally, the monitor that replaced her said she's nuts. Like literally, clinically insane.
Fortunately, in my almost 10 years, I've never come across somebody like
So
that.
you got a little bit lucky.
I got very
Just to
lucky
give
then.
people general context of like all this. Like, how many studies do you think you've managed throughout this time? 9 years.
Oh gosh, about 20, 25.
All by yourself.
Yes,
That's crazy.
yes,
2025, all in that time period.
yes.
So the bad, you don't have anything else like bad?
The bad for me, I would think, is if we're doing a study and I definitely see that the people are being helped with it, and then the study comes to an abrupt end, and the people are kind of left high and dry. That's the part that I really don't like. I don't like studies also to where we have to wash them off of their medication. Because I feel that if a subject is stable on the current medication that they are on, just to wash them out, just to put them on an experimental drug, I think is very unethical.
It's a good point.
So-
A lot of doctors agree with you. A lot of clinicians agree
Yeah.
with that point.
I would add the cherry picking subject because I am just starting a study now in a dermatology study, and they want like the impossible patient to find. So they're cherry picking. They don't want the real world patient that's actually out there. They want like a patient who almost doesn't exist, and they want you to find that patient, that needle in the haystack. I call that the ugly.
That, yeah, but I mean, we were known for cherry picking as well. We just had
Yeah.
more to cherry pick from,
Yeah.
so we did make sure that we picked people that were living in a boarding care home where medication was monitored so that we had compliance with the meds.
Did you do all psych studies for those watching?
Yes.
Mostly. Any non-psych?
No, predominantly all psych. I mean, even the tardive dyskinesia, you still had to have the underlying diagnosis of schizophrenia or bipolar,
Did
but
you do a smoking cessation study though?
that was out of another site, and I was basically the phlebotomist on
Oh,
that study.
okay.
Yeah, I
Casey's
didn't do too
licensed
much.
phlebotomist.
Yes, I
True
am.
generalist.
Yes.
Okay, and the ugly, if you have any. I don't know.
Can I say his name on camera? No.
Why not?
Tudor. There you go. You pulled it from me. You pulled it from me. Nah, he made it very ugly. He made it very, very ugly. He made it difficult to do a good job. So I would say, bottom line, that is the ugly. That is
Expect
the
a
ugly.
cease and desist letter from his desk.
Right? He's gonna sign it personally himself, right?
Yeah,
He is an attorney.
That is
we're
right.
safe with no last name, so we're good. Okay, what else? Anything else? What are you looking forward to, like, going forward? I know you're going to be working with us in various capacities. Different. We got a lot in plant, with lots in store. Me and Chris got lots going on right now that you're going to be front and center on all of it.
I think the change is going to do me good. I think that's what I'm looking forward to the most, is because things have been a little stagnant here, and it's, I'm ready
In the
to
last,
kind
like,
of,
year and a half or so.
yeah, I want to get back out there and just get busy with a lot of different things. I'm always up to learn new things.
Work is always boring it's always difficult and elongated when it's boring.
Yeah,
Right?
Yeah.
It's most difficult when boring.
yeah.
Yeah. All right. Anything else?
No, I'm just
got a
looking for it.
LinkedIn,
Let's
right?
go. Let's get started.
You got a LinkedIn?
Yes, I am on LinkedIn.
Okay, so I'll put Casey's LinkedIn underneath the show notes. Thank you guys for watching. Thank you, Casey. Thank you, Chris.
Thank you guys.
Thank you, Studies, for treating us well.
Right?
Bye-bye.